Happy to have with us here at ASH 2013 Sandy Kurtin. She's an RN professor at the University of Arizona in Tucson. Thanks for being with us.
Thank you for having me.
What insights do you have regarding the future of diagnosing and treating multiple myeloma?
Well, there have been some very exciting abstracts and presentations already here at ASH. We've heard a number of things about the diagnostic workup, revisiting things like flow cytometry, imaging techniques such as low-intensity CAT scans, which really haven't been in the mainstream just yet. Really trying to refine the diagnosis and adequately stage people, which then will dictate the appropriate treatment. So we're learning a lot more. We know already the risk stratification relies heavily on cytogenetics, but what we're learning is there's the next level of information, gene expression profiling, and other kinds of imaging and cellular diagnostics.
In your experience, how does a multidisciplinary approach work best for patients with multiple myeloma?
Well, I think multiple myeloma we know is not at this point a curable disease. We hope to get there someday, but at this point it's incurable. And so people are often treated over many, many years. It can be a very complicated disease journey with ups and downs, and relapse is inevitable in most cases. And that really requires a multidisciplinary approach, needing the physicians, other providers such as advanced practitioners, nurses, nutritionists, social workers, and really integrating everybody so that you can get the patient what they need over the course of time.
You mentioned advanced practitioners. What type of role do they play?
Well, I've been in oncology 29 years now, and a nurse practitioner for almost 19 of those years, and I think the role has evolved over that period of time. We know based on published data that there is a shortage of primary care physicians and oncologists expected in the future, and yet we have a significant growth in the elderly population, baby boomers, which I'm at the tail end of that just in case anybody's checking dates. But there is a need, and I think we also know that the treatment is becoming more complicated. Much of it is done or provided in an outpatient setting, and so it just takes that kind of manpower. I think we bring something unique to the clinical setting, and one of the things that we have done recently is initiated a new publication called JADPRO, the Journal of the Advanced Practitioner in Oncology, which is dedicated specifically to this population of advanced practitioners, NPs, PAs, clinical nurse specialists, clinical nurse educators, and we really are trying to bridge the gap between the medical literature and the nursing literature and provide this group of very important individuals with specific clinical information that they can use readily. We're also very excited to be having our first live program, which will be in January in St. Petersburg, Florida, really clinically relevant information.
Where can we lead people who may want more information about the 2014 JADPRO meeting?
Well, you can go to JADPRO, Google JADPRO, JADPRO Live, and or you can refer to the Journal of the Advanced Practitioner Oncology, and there is registration information readily available to you.
Sandy, thanks for spending some time with us. Sandy Kurtin, RN and professor from the University of Arizona, joining us here on Oncology.TV.